Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Non-epidemic or sporadic puerperal mastitis. So non-epidemic or sporadic puerperal mastitis includes whenever there is involvement of here in non-epidemic or sporadic puerperal mastitis, there is involvement of interlobular connective tissue of the breast by an infection. That is, there is infection of interlobular connective tissue of the breast. That is called as mastitis. So here if you see, this is the glandular elements of the breast, but in between the glandular elements you will see the presence of interlobular connective tissue. So if there is infection of the connective tissue, especially after the or in the puerperal period, then we call it as non-epidemic or sporadic puerperal mastitis. Here the patient, actually first and foremost, here the patient will have nipple fissuring will be seen, and also milk stasis. Because of nipple fissuring and milk stasis, or because of fissuring of the nipples and also accumulation of the milk, this will result in retrograde bacterial infection, especially from the mouth of the baby. This retrograde bacterial infection will result in infection of the breast. So how are you going to treat it? Treatment is mainly by the emptying of the breast should be done. To prevent the milk stasis, we should ask the patient to empty the breast by suction pump, and this will decrease the duration of symptoms, and this will also reduce the incidence of recurrences also. This will also reduce the incidence of recurrence. Then we can also add antibiotic therapy can be added to the patient. Emptying of breasts is done with suction pumps.
thank you and thank you for watching.